Ben Television UK, transmitting from London to Europe, Caribbean and Africa, and welcome you to our weekly program focused on Ogun State, featuring the activities, projects and update press briefing on COVID-19 containment by Governor Dapo Abiodun. On Friday, 15th May 2020, the Ogun State Governor, Prince Dapo Abiodun, addressed the press on the update, medical statistics, the lockdown measures, and other initiatives to ensure the overall objective of safeguarding the health and well-being of the people.
My last week's briefing, the number of confirmed cases in Ogun State was 100. But by yesterday, Thursday, 14th of May 2020, we have recorded 34 more positive cases of COVID-19, bringing the total to 134. This shows an increase of more than 30% in just 1 week. In the same period, we also discharged 20 additional patients who have been successfully treated at isolation centers, in addition to the 39 earlier discharged, thus bringing the total to 59. These have been given a clean bill of health and have since rejoined their respective families. The rate of recovery is very heartwarming and is encouraging. We pray that this pattern continues. Unfortunately, we recorded a total of 5 deaths. We pray God to repose their souls. This leaves us with 70 active cases who are currently receiving care at our treatment centers. As usual, we hope and pray that they will also be discharged in due course. The spike in the number of positive cases, particularly in the last 1 week, is attributable to 2 main factors. First is the expanded testing capacity, which is currently at 450 per day. This has enabled us to embark on aggressive testing, especially in the communities with possibly high prevalence of infections, such as border communities. The testing has presented us with the stark reality that community transmission is on the increase in our rural and urban communities in the Ogun State. We will keep expanding our testing capacity by deploying more personnel and testing centers to every nook and cranny of the state. This leads me to the second factor for the increase in the number of positive cases. In spite of several warnings and concerted efforts of our security agencies, a number of our people have continued to flout the measures in place to flatten the curve of the spread of this virus. Some residents still come out in public without the use of face masks, or the use of face masks in a manner that do not shield their mouths or their noses. Motorcycles and tricycle riders still carry more than the approved number of passengers of 1 or 2 respectively. And drivers of taxi cabs and passenger buses are also culpable in these flagrant violations of the extant guidelines. I even understand that some drivers are in the habit of keeping face masks in their buses and giving to passengers when they come to their vehicles and collecting them back when they are light. Our markets have also not fully complied with physical distancing and other measures to ensure markets do not become COVID-19 transmission centers. Between 4th of May and yesterday, 108 violators of the lockdown and other measures have been apprehended and prosecuted. They were promptly tried by the newly introduced mobile courts, with some of them need to pay fines, while others are undergoing community service. Consequently, in view of the evidence of community transmission and poor compliance with the lockdown measures, we are constrained to retain our current ease of lockdown, meaning that what currently obtains this week, we will repeat for next week. This is our modified ease of lockdown. So this will obtain till Sunday, 24th of May. That current pattern allows for relaxation windows from 7 a.m. to 5 p.m. on Monday, Wednesday, and Friday. We'll continue to monitor the level of compliance with the lockdown measures and incidents of community transmission, and hopefully there will be positive developments that will enable us to further ease the lockdown at the end of this new lockdown period. We are actually very positive that that should happen. You must also bear in mind that the daily curfew from 8 p.m. to 6 a.m. and the ban on non-essential interstate travel as directed by Mr. President still stands.
While noting that survival is a personal responsibility, Prince Dapo Abiodun enjoined the people to join hands with government to flatten the curve of COVID-19 in the state. He appreciated individuals and organizations that have continued to partner and support the state in managing the pandemic and mitigating the effect on the citizenry.
Thank you, gentleman from BNTV. Thank you for that question, because this was actually meant to be part of my press briefing tonight. My health team have actually decided that we are going to change our protocol that obtains currently to a modified protocol. Currently, when people that have symptoms of COVID-19 present themselves for testing at testing centers or at any of our centers, their test samples are taken and it's sent to the laboratory while they are waiting the results. Usually it takes about 24 hours. But what we notice is that some of them just disappear. By the time we try to reach them to let them know whether they are positive or negative, we can't find them. And these are cases that are worrisome. It means that when they're positive, the chances of infecting others does exist. So what we're considering doing going forward is that when people present themselves for testing and have symptoms, we begin treatment from that point. So treatment commences immediately while we await the test results. So this means that, the chances of the patient infecting others should be largely reduced. So these are some of the ways that we are creatively devising to fight this pandemic, alongside with all the other initiatives, hygiene initiatives, physical distancing. You appreciate the fact that we have continued to be very consistent in our lockdown approach. We never locked down for an entire week. We locked down, we gave windows of relaxation 3 days a week to allow people to conduct their essential businesses, and also to allow people to ventilate, because these have been proven to help possibly psychological health. On international support, I'm not aware that we have received any international support from any international organization. I'm not aware. Would we appreciate that? Of course we will. We are open to support from any source, either Nigerians in diaspora or any other multilateral organizations. We are hoping that as this continues, we'll be getting support from all and sundry. And those that give us support so far, we are indeed very grateful. Thank you very much.